Hi everyone, my name is Dr. Nicholas Bastidas and I am a pediatric and craniofacial plastic surgeon here at Northwell in New York. Of all the things we do in plastic surgery, probably one of the most difficult yet rewarding is total ear reconstruction for our microtia patients. As you know, we're all trained to do autologous ear reconstruction using rib cartilage. The big problems with that, it was always, I felt, the fact that we had to wait until the child was 9 or 10 years old to have sufficient rib cartilage to create the framework with, as well as the painful operation the child had to endure, the potential for pneumothorax, for scarring, and basically just the frustrations of having to deal with potentially limited amount of material, being the rib cage cartilage. I explored using MedPore as an alternative for alloplastic ear reconstruction. MedPore, I think, gives great results. The frustrating part with this was the fact that you needed to use a TPF flap, which is an insensate flap since there's skin grafts applied on top of it. But I love the fact that it was an off-the-shelf product that the child could basically go home the same day with and not have additional scarring and very easy recovery. And you could also do it at a very young age, age of 5. The thought was, well, I wish there was a material that we could use that would kind of blend the best of both worlds. And using MTF cartilage for things like cleft nasal reconstruction, I petitioned the company, seeing if we could basically have a total rib segments to work with so that I can create an external ear using this material instead. The thought being this would provide all the benefits of MedPore as well as autologous ear reconstruction. Since you have an off-the-shelf product, you have no need for a donor site, you have a very quick recovery and a non-painful recovery. In 2020, we performed the first total ear reconstruction using Extearna, which is the MTF rib cartilage that's provided. We were able to do this in a Treacher Collins patient who had a very small rib cage and had a bilateral microtia. She underwent this procedure, first 2 stages, in 2020 and subsequently did great post-operatively without any complications, and basically had a result that's now been 2.5 years that I think is identical to having used an autologous rib construct, except without having to put her through the donor site morbidity. This first operation, I was able to create the auricular framework prior to bringing the patient into the room. So she only underwent general anesthesia for less than 1 hour and basically went home 1 hour upon discharge, had maybe 1 or 2 doses of Tylenol during the night and reportedly did great post-operatively after that. So this opened my eyes to the potential to using Extearna rather than autologous or MedPore reconstruction, and I've since performed approximately 30 ear reconstructions for both congenital as well as burns and for trauma. Extearna so far has been a great product. I haven't seen any resorption, significant resorption. I haven't seen any infection. The only complications I had were related to the soft tissue covering the Extearna, which is no fault of the cartilage itself. The material is very easy to work with, very pliable, and it's done the exact same way as it would for an autologous, except you don't have to wait until the child is 9 or 10. You can do it at age 5, potentially, and get these great results. So I feel like this is definitely a wave of the future. It should be something considered in our minds when we're discussing options with our patients. And it's a very safe and simple product to work with, and it's definitely been exciting. I think it's revolutionizing ear reconstruction for all of us.